Hello, everyone. This is Dominica Murphy. I'm the Community Director of Surround Health. I wanted to welcome to all of you for attending today's webinar that has been sponsored by the National Communication Association entitled Health Literacy. Thank our sponsor, the National Communication Association. Month on April 24th, which will focus on the Educate, Ask approach. So if that sounds like something of interest, be sure to look out for an invitation in your mailbox. I encourage you to go ahead and visit the to learn more about not only the organization, but also how to become a member. Just a couple of things to keep in mind. We will be taking questions at the end of the webinar, so if any question comes up for either of the speakers, please type them into the questions section, and we will get to them at the end. We are also tweeting during the webinar, so if you're interested and are on Twitter, please use the hashtag #. And it is also being archived, so if you miss any portion of the webinar, you can access it via the archive. We have also been approved for 1 CHES and 1 RD credit. So just if you are interested in getting those credits, please be sure to complete the feedback survey that you'll get in the thank you email. So we have a wonderful webinar planned for you today with Ken Thurlton and Rita Williams. Both Ken and Rita are from the Health Ed Group, a patient company located in Clark, New Jersey. Ken is an expert in the field of educational design, health literacy principles, and instructional design as they pertain to the creation of patient. He speaks frequently on these subjects and has conducted training workshops throughout the U.S. Ken works very closely with health education practices within the design industry. He's a Hoosier transplant, having lived. Rita Williams is responsible for developing and leading a variety of patient-centered health education programs here at Health Ed. She plays in ensuring that her programs integrate adult learning principles and behavior change theories, and that they're health literate. Rita initiatives and also serves on the Cancer Patient Education Network's Health Literacy Committee. She holds a master's in education from Teachers College at Columbia University and is also a certified health education specialist. And now I'd like to turn it over.
Great. Thanks, Dominica, and thanks to all of you for joining us today. We have a lot of great information to share. So before we get started, I wanted to just briefly review the key objectives of today's webinar, which are to review the importance of creating patient-centered, clear health communications, to discuss how to develop and select patient education materials that meet health literacy principles, and to provide strategies to assess and improve health literacy in your organization or practice. Okay, so let's get started. First, I'd like to introduce the concept of beyond the core. Let's see. Great. Okay, so what is beyond the core? Beyond the core is really an approach that looks at 3 types of health literacy interactions and skills, ranging from basic core skills like reading and writing to more complex skills such as advocacy and empowerment. The 3 types you'll see here in this infographic are core, engaged, and influential. This infographic will be available to you as a download on Surround Health after the webinar, so you don't need to worry about reading all of this in detail right now, but I do just want to take a minute to briefly describe the 3 types to you. So core health literacy focuses on basic skills, as I just mentioned, like reading and writing. Think of these as skills that can help an individual to function in their everyday life. Engaged focuses on more advanced or interpersonal skills that people need, like decision-making, problem-solving, or communicating with their healthcare providers. And the third is influential, which is not just about the individual and interactions they have, but really goes beyond. It involves empowering others and action on the community level. I also do want to mention that once you've downloaded this, you can certainly feel free to share this infographic to help raise awareness of health literacy within your organization and with others, and it just really gives you a good snapshot showing the range of health literacy needs. Okay, so before we get started talking about ways to address low health literacy, I just want to take a step back and spend a couple of minutes talking about the problem at hand. For someone to manage their own health, these are some of the key things he or she would need to be able to do. For starters, they need to be able to understand the healthcare system. This includes some basic skills like filling out forms and finding the right doctor, understanding medical instructions. How do I take my medicine? What do I need to do? Which it all really comes down to being able to take care of themselves, and in many cases they need to be able to take care of others, whether it's doing things like monitoring blood pressure, reading food labels, or making decisions about medical tests. So as you can see, it's really not just about being able to read health information, it's about understanding that information and being able to take action. And pretty much across the board, what research has found is that health literacy is directly related to health status. So higher literacy correlates with better health status, lower literacy correlates with poorer health status. And we've also learned that low health literacy has a negative impact on patients, as well as really on the entire healthcare system. For example, people with low health literacy tend to enter the system when they're sicker or have more advanced stages of disease, such as cancer. People may also have higher rates of medication errors because they simply didn't understand how to take their medicine, which can also end up in sometimes more frequent ER visits. So I'm sure many of you have encountered these situations and have seen the impact of low health literacy in the work that you're doing every day. But it's important to know that knowing someone's health literacy level or ability is not enough because circumstances can also impact a person's understanding. For example, when a patient or family member is coping with a new diagnosis or the onset of an illness, for instance, or really under any kind of physical or emotional stress, they may just have a harder time understanding the information. What the doctor or nurse says to them may just be all a blur because they're simply overwhelmed, and when they're in that situation, people can misunderstand what they hear or they can make mistakes in their treatment plan. So it's important to remember that it's not an individual's deficit, but everyone, regardless of their health literacy level, prefers communication that's clear and easy to understand, especially when it's related to their health. So this pie chart shows the percentage of people in each of the 4 health literacy classifications. As you can see, 36% of the people in the survey had basic or below basic skills. That's more than 1 in every 3 adults. And just to give you a little more context, so people with below basic skills can do tasks that are more rudimentary by nature, whereas people with basic skills can do things like read and understand short brochures. Intermediate skills includes understanding most text and numerical information, but not necessarily all of it. And then people who are proficient means they can do more complex skills, and this is about 12% of the people who are in the survey. They can do things like searching and analyzing health documents, and they have a good understanding. Of both content and numerical information. So it's important to note that even though people who are proficient, they still also may have certain limitations. Okay, so now we're going to do a quick poll. Dominica's going to pull that up for us. And we'll give you a minute or so to answer this question. So what is a task that people with basic health literacy skills can do? The first choice is to read a pamphlet and give 2 reasons a person should be tested for a specific disease. The second one is to circle the date of a medical appointment on a hospital appointment slip. Third, find information to define a medical term by searching a document. Or the fourth choice is to determine a healthy weight range for a person based on body mass index graph. So we'll give you a minute or so just to answer this question. Okay, so now we're going to go ahead and close the poll. Looks like, so most of you said circle date of medical appointment on hospital slip, which is actually a skill of below basic. So basic skills really are able to read pamphlet. They're able to read the pamphlet and give 2 reasons a person should be tested for a specific disease. And the circle date for a medical appointment, which most of you responded, is actually a skill that a person with below basic skills should be able to do. Okay. So what types of problems do people with low health literacy experience? Well, they may take words literally. For example, eat less red meat. Does this mean eat meat that is less red or eat less red meat? They may also read slowly and miss meaning. skip over hard words or uncommon words, get lost in the details, have difficulty finding a central focus, and they may tire quickly. All of this really impacts their ability to understand and take care of their health. So now I'd like you to just take a moment to see if you can decode this passage. As you can see, some of the key words are spelled backwards. I like showing this because it's a really good example of what a person with low health literacy may experience. The long or unfamiliar words, like the ones that are written backwards, can slow down a person's reading speed and also have an effect on their understanding of the information. So now just imagine if it were this difficult to read and understand your health information on a daily basis, it'd be quite challenging. So this exercise just reinforces to me how important it is to use materials that are both easy to understand and actionable. And we can do this by applying the Clear by Design health literacy principles, which we'll be talking about next. So the Clear by Design health literacy principles were developed at Health Ed by a team of health educators, copywriters, and designers. And they were developed using a number of health literacy tools and principles and also experiences working with patients. This may feel like a lot as we're going through it, but we'll also be providing you with a list of these principles as a download, so not to worry. I also just wanted to mention before jumping in that although not all of you will be developing your own materials, these principles can absolutely still apply when evaluating and selecting clear patient-centered materials. So now that we've gotten a glimpse into the challenges of low health literacy, we'll talk about how these actual principles can help you develop or select patient materials. This is a list of the 7 main principles, and we'll be talking about each one in much more detail. So this first principle is to provide content that solves problems. Many times, as we know, health information is focused on medical facts and disease pathology. However, patients with limited reading skills want to know what to do to manage their health and how to do it. So this requires some careful planning right from the beginning of a project as the content's being determined. And the goal is to narrow down the content to what's most important and actionable for them. As shown here, the first sub-principle is to make the purpose evident. One way to do this is to provide introductory copy and a content overview or a table of contents, which will help the readers really just know what they'll learn from reading the material, and they also provide readers with a roadmap of sorts for what's ahead. This next example shows it limits the number of concepts to be learned. So this is an example of a piece that has one concept and a clear title that helps the reader know if this piece is relevant to them, again, from the very beginning. You also want to ensure that the material focuses on mainly behaviors rather than medical facts. And when you include the facts, try to make sure that they're the most important and impactful. In this appetite changes example, the majority of the content really focuses on tips for making eating easier. And to help readers adopt these behaviors, the creators actually provided an easy-to-follow chart with sample menu items that you'll see on the right side, which is really very helpful. And the last sub-principle is to review key points. A summary can help the readers remember the most important information in a piece and really just reinforces the key takeaways. So now I'm going to turn it over to Ken to review the next few principles.
Thank you, Rita, and welcome everyone to this valuable webinar. So Principle 2 of the Health Literacy Guidelines is to write for easy reading. Writing clear content that is easy to understand is a combination of factors, and these include using the active voice, using common words, defining new terms, give context before new information, chunking information with subheads, and write for 6th to 8th grade reading level or lower. And so now we'll talk about each of these guidelines in more detail. So one example of writing for easy reading is to use the active voice. And here's an example of passive and active voice. But in active voice, the example to the right, the subject, which is the doctor, performs the action, which is discuss the different treatment options, and is expressed by the verb, which is will discuss. That is to say that the subject acts. So a sentence written in active voice is easier to understand and generally requires fewer words. Another guideline when writing for easy reading is to use common words. So on the left are words that may be uncommon for readers to understand and difficult to comprehend. but on the right are the same ideas expressed in simpler terms and therefore easier to understand. So when you write for easy reading, you also want to define any new terms. And in this example, the copy defines or explains new or uncommon terms by using parentheses. So systolic pressure is explained as when the heart beats, and diastolic pressure is defined as when the heart relaxes between beats. The next guideline is to give context before new information. And here, the brief introduction provides context for the new information that follows. The example provides readers with basic information about vitamin B12 before stating their daily requirements. Another guideline within Principle 2, Writing for Easy Reading, is to chunk information with subheads. Subheads can really help readers navigate the content in a piece. And this is an example of a piece that properly uses a subhead to group relevant information. So with regards to chunking of information, you should also limit bulleted lists to no more than 7 items. And this keeps the information concise and does not overwhelm readers. The next guideline is crucial, really, when creating content that is easy to read. You will want to write for a 6th to 8th grade reading level or lower. And here's an example of content that was written at the 12th grade reading level, and I'll just read aloud a bit of the beginning. Bones are living tissues that hold together the structure of the body. When these tissues begin to deteriorate over time, and as people get older, they become more prone to getting osteoporosis. Osteoporosis is a disease that weakens the bones and makes them easier to break. And here is the same content, but written at a 6th grade level. Osteoporosis is a disease that weakens bones to the point where they break easily, most often bones in the hip, backbone, spine, and wrist. Osteoporosis is called the silent disease because you may not notice any changes until a bone breaks. All the while, though, your bones have been losing strength for many years. So what you'll notice is that the sentences are shorter and the information is chunked. The passage written at the 6th grade level communicates the key points in a similar but simpler way. So in order to make sure you write to a 6th grade level, you need to be able to measure the result. And you can do this by using the Fry formula. This is the preferred tool of the literacy community for determining reading level. And by using 3 100-word samples from the document, it looks at both sentence length and number of syllables, which are both indicators of level of difficulty. The Fry software can be purchased or downloaded, and information about it is listed on the resource guide handout that will be available for download following this webinar. So we just discussed principle number 2, writing for easy reading. The next principle to keep in mind when developing or evaluating materials is to also design for easy reading. This can be achieved by following these guidelines, and we'll again show examples of each of these in upcoming slides. So you'll want to provide adequate white space, provide consistency in layout from page to page, use the appropriate type style, as well as using an appropriate type size, and use uppercase and lowercase letters. Again, all of these guidelines will help you develop or evaluate materials that foster ease of reading. The first guideline is to provide adequate white space. So what do we mean by this? Well, adequate white space is the blank areas of the page around the text and graphics, which helps keep the design simple and enables readers to focus on the main feature and message. White space really helps readers feel less overwhelmed when trying to focus on content. And the key to achieving our adequate white space on a page is to balance the content with the visuals and the unused white space. So some general guidelines to consider would be to use at least a ½ inch margin around the document, a ¼ inch gutter width, which is the area between columns of type, and to make sure graphics and text aren't placed too close together. The next guideline to consider when designing for easy reading is to provide consistency in the layout from page to page. And this is done by placing text, images, and other elements in similar locations on each page throughout a multi-page document. This can really help readers know where to find information from page to page. And in this example, you can see that there are 2 columns on each page, one used for images and captions, and one for copy. Another guideline is to use the appropriate type style. This can be done by using a serif font for body copy and a sans serif font for titles, headings, subheads, and a small caption. A serif font typically has what is called hooks and tails, and these are the elements of the letters, such as the curved downward portion on the capital C shown in the example, and the bottom right curve in the lowercase a. You'll want to use a serif font for body copy since they are universally recognized as easier to read than sans serif fonts, and they tend to guide the eye better through the sentence structure. Sans serif fonts, sans actually means without, so these are letters contained without the hooks and tails of serif fonts. The example here shows a sans serif font style, which again can be used for titles, headings, subheads, and small captions. You want to also make sure to use an adequate type size. Generally, try to use a 12-point font for your materials. 12-point type is preferred, but smaller sizes can be used since font sizes are not visually equal. As shown in this slide, not all 12-point type is created equal. However, any font below 10-point can prove difficult to read. One thing to note is that the visual size of 12-point type could be compared to what you may see in a typical paperback novel. The next guideline when designing for easy reading is to use uppercase and lowercase type, not all capital letters. Using all capital letters is hard to read because the words are all the same height, and it is sometimes interpreted as the equivalent of shouting. So now let's move on to Principle 4, using color with purpose. The two guidelines to remember when creating or evaluating materials are to provide contrast between text and background and to use blocks of color to highlight any key messages. To make sure you are using color that has purpose, there should be a noticeable contrast between the text and background. A good rule is to always use dark type on a white or light background of color and to use little or no knockout type. Knockout type is the use of a light or white text on a dark background. The second guideline of this principle is to use blocks of color to highlight key messages. Color can really help to differentiate and highlight key messages on a page. And this could be a tip section, a glossary, a sidebar on resources or treatment tools, or any other small amount of copy that should be more prominent on the page. Again, though, you'd want to make sure there is an appropriate amount of contrast between the text and the background. So moving on to Principle 5, using visuals for emphasis. And this can be done by using photos and illustrations to demonstrate the desired behavior, using images to represent the audience, using tables, charts, and diagrams to explain information, and using graphic elements in order to highlight important sections or information. So overall, visuals can really help explain information, reinforce important content, and provide relief from dense areas of text. So the first guideline is to make sure to use photos and illustrations to demonstrate desired behaviors. Readers with low literacy levels might rely on pictures to help them understand information and to show them what they need to do. By placing these images close to the copy that is describing the desired behavior, as well as providing captions to the visuals, this will help readers comprehend the information better and hopefully move them toward engaging in the positive action that is being depicted. Another way to use visuals for emphasis is to use images that represent the audience. Readers really want to see themselves and their concerns related in the piece, so be sure to use pictures and illustrations that represent the target audience by depicting their age, race, and body type as it relates to the health condition being described. The next guideline when using visuals to emphasize is to use tables, charts, and diagrams. These visual elements help to explain and simplify information on a page. And when using these elements, be sure to provide captions and or subheads to help explain or summarize the information. The last guideline of Principle 5 is to use graphic elements to highlight important sections or information. You can use graphic elements like the bullets shown here to highlight key messages. This is helpful for lists, a summary of key points, any action steps. You can also use other images, such as the pencil shown here, to designate areas where the reader can complete information. Again, these all help to focus the reader's attention on areas of importance. So now I'd like to turn it back over to Rita, where she'll finish out the last two principles to consider when developing or evaluating materials that adhere to health literacy guidelines.
All right. So building upon these health literacy principles, it's also important to use adult learning principles, one of which is to involve the reader. This can just help the materials to have a greater impact overall. So what are some ways that you can do this? You can use positive and friendly tone, which is always good, and you can find opportunities for people to interact with the material. So in terms of positive and friendly tone, if you look at the before example, it doesn't speak directly to the readers. People with low literacy have a hard time making inferences and might not make the leap that all Americans actually includes them. Something fairly simple like using the U voice can help lower the literacy and help readers just connect with the information. And overall, focusing on just simplifying the language in a way that perhaps how you would just speak it and avoid jargon will help to make it more clear. Also, giving readers ways to interact with the material allows them to absorb and apply the information even more. This can be done in many ways, such as incorporating checklists, question and answers, fill-ins, or notes pages. All of these are great options, and it's just important to remember that people learn in so many different ways, and engaging them in learning will hopefully just help to improve their comprehension. And the last health literacy principle we'll talk about is testing materials with learners. So in order to create messages that really speak to a patient's educational needs, it's important to include the patients and care partners in the development process from the beginning if possible. So by doing this, we can test to see how well users might understand the words and concepts, how they respond to the illustrations and photos, as well as how well they're able to interpret the data, charts, tables, or complete any of the interactive sections that may be included. And there's many ways that you can do this. It certainly doesn't have to be complicated. For example, what we often do is we recruit a small panel of people in our target audience. We'll then email or mail a piece for their review with a questionnaire for them to answer and send back to us. But you can also organize a focus group or use just a more informal small group review to understand how clearly the piece communicates and what they think of it. So I know one example I'd like to share is of a time we sent out a brochure that we've been developing on Alzheimer's disease, and we sent it out to a panel of patients and caregivers. We were following a style that had actually already been established where the images were close in and cropped, and if you can picture this, basically the person's head was cut off from the forehead and up. And we got some strong feedback from some of the caregivers who thought that this was intentional and just making a statement about the patient's memory or their ability to think, and they were just looking at it really from a personal experience. And it just reinforced for us that as focused as we are on our patients and their needs, we may still miss something sensitive that just stands out to them. So now Ken's going to walk through an example that pulls these principles through.
Great. Thanks, Rita. So now we've discussed the 7 principles for creating and evaluating materials that adhere to health literacy guidelines. But you may be asking yourself, what does it really look like when I start applying these guidelines to my materials? And would readers really understand the information any better? So we've created a before and after example. And this example is really a great way to see the impact of using health literacy guidelines and how, by understanding the principles and applying them where appropriate, readers will comprehend the information better and therefore take a more active role in their treatment. So before we talk about this before example, let's take a minute here, and if you could type in your chat box on your webinar panel, let us know what you think may be some of the health literacy concerns with regards to the content and layout that you see in this example. This before example is about the stages of breast cancer. These were continuous pages within a multi-page document. So let's just take a few moments and see if there's any questions or issues and concerns you can come up with. So go ahead and make sure that you're typing any of your issues or concerns you think this piece might have into your chat box. Okay, well, let's go through some of these together. So first off, the body copy is less than 12 point and appears very dense over these 3 pages. The content flow is confusing, so really notice the use of stages versus staging. Clinical language is used for copy and subheads, items like lobular carcinoma in situ and nodal status, and the stage terms could be overlooked since they are included within body copy with no visual hierarchy. The tab content is all in caps, and Roman numerals are being used, which could be difficult to translate for readers with numeracy issues. So overall, these pages are very text-heavy and have a lot of medical information that is hard to decode. And here's the after example of the same information. So here, the flow and specific content has been reordered and written to a 7th grade reading level. The complete story is told through subheads. How large is the tumor? Where has the tumor started? Where has the tumor spread? This helps those readers who are scanning the page before actually beginning to read all the content. The subheads are also in a question format, which allows for more reader interaction with the information. Information is chunked into sections and difficult terms have been defined within the text. The tab content now uses uppercase and lowercase letters, and color highlights information regarding tumor types within the chart. And another great way to bring information to life and thus make it more memorable and informative is by the use of analogies. Here, visual analogies are used in order to describe the tumor size. The size of a walnut is more relevant and understandable than 4 centimeters. And in the end, white space has increased through the use of margins, gutters, and image placement. And here is the side-by-side comparison. In the after example, the information certainly appears easier to read, with much more opportunity for the reader to internalize and interact with it. Now Rita will provide you a wrap-up to the Clear by Design health literacy principles, and we'll speak to how to assess your healthcare environment with health literacy in mind.
Great, thanks, Ken. So thinking back to the Beyond the Core infographic we talked about at the beginning, Clear by Design focuses on core health literacy skills. And as we've just gone through all the principles, you can see it is so much more than reading level. I also just want to reiterate that it's so important to remember that everyone can benefit from health literate materials, and taking the time when developing or selecting materials is certainly well worth it. I also encourage you to for all of you to compile a checklist of health literacy principles for your institution if you don't already have one. You can standardize it and use it across all of your publications so that you know you're hitting on the points that are priorities for your institution and that are also realistic for you to implement. We develop patient education materials, and to be honest, it's rare that we can hit 100% of the principles every single time, but we can get really, really close, and it does help that everything we produce is reviewed by a panel of patients, caregivers, and healthcare professionals. Okay, so next we'll be talking about assessing your healthcare environment from a health literacy perspective. So imagine that you, the patient, are coming to visit your practice for the first time today. What will your experience be like when you call to make your appointment? What paperwork will the staff ask you to complete or produce? What will you discuss with the doctor, and will you understand it? There is a lot to consider, and in this section we'll discuss ways to assess how patient-friendly your practice is. And again, like health literacy principles of patient materials, making your workplace patient-friendly will certainly benefit all patients. Okay, so thinking about your healthcare environment, the key areas to assess are navigation. This includes things like telephone communication and the entrance and the lobby. Print communication not only involves creating or selecting patient materials like we just discussed, but also assessing existing patient materials that you're currently using. You also need to assess whether the oral communication is clear and patient-friendly. And I find this interesting because depending on how it's done, it should include the patient's perspective, which can at times be very revealing. Another key area is technology. So this assessment looks at things like the televisions, computers, and kiosks, how they're being used, and where they're placed. And last is policies and procedures, which may review aspects such as staff training. So one thing I want to point out is that there are some wonderful resources out there to help you assess your practice. We've included a few of them on the resource guide that you'll be able to download after the webinar as well. You may choose to do all the activities or just a few of them depending on your priorities and the time that you have, But for example, the telephone assessment will provide you with a sense of the first impression that people might have of your facility. The walking interview will help you gain insight into the physical characteristics of your facility that you might not otherwise notice. And the oral exchange, as I just mentioned, draws on patients' experiences and impressions of any communication issues that may exist. So taking the time to do an assessment can just help to identify what are the existing strengths, what are the limitations, and just help set the foundation for any improvements moving forward. Okay, so once you've assessed your healthcare environment, it's now time to develop an action plan. First, you should just prioritize what's feasible to accomplish and then set some goals. Again, keep in mind that these changes will absolutely be specific to your institution and should take into account your priorities as well as any cost considerations. So for today's purposes, we're going to use navigation as an example. So as we know, telephone is often the first contact a person has with the facility, which can shape someone's impressions. If you have an automated system, some improvements to consider might be to offer an option to speak with a person, or try to have the recording use a more conversational tone as well as just clear and simple language. If you have a live person answering the telephone, some things you can focus on through training might be speaking tones and pace, using everyday words and phrases, and just making sure that they can confidently answer any of the common logistical questions. So what about locating or navigating through healthcare facilities? It's well known that many people have a hard time with this, and it may be even harder when the facility has multiple entrances and wings that are not all clearly labeled, and just in general when visiting a facility for the first time. I know recently I was 10 minutes late to an appointment with a new doctor when I couldn't easily find the office I was looking for. And when I got there, by following the signs, I was told the office I was looking for had moved. So luckily, though, it was just next door. But in regards to the entrance, some improvements you can make may seem like common sense, but just make sure that the name is displayed on the outside of the building so patients can recognize that they're in the right place. Use signs with plain and everyday words like walk-in. In the lobby, having welcome sign or a welcome information desk is also helpful. And also displaying artwork in the lobby that just shows diverse groups of people or the local area, local people, can just help make people feel more comfortable. And in terms of guidance, it can be helpful to have staff members or volunteers available to guide. And the last area we'll quickly touch on within the area of navigation is maps and signs. So as we just talked about, many people have a hard time with this, so having clear and simple maps is really important. But it's not just about having them. The placement can make a big difference. For example, it may be easy for people to walk right past flat signs on a wall, whereas when they're combined with other signs like overhead signs or signs jutting from the wall, they just become more noticeable. Highlighting where they currently are on a map and navigating them from there is also a helpful tip. And some places have their staff or volunteers give out handheld highlighted maps, which is even more tailored to a person's destination. So whether it's a map, a sign, a lot of this overlaps, but you want to make sure to use consistent symbols, graphics, and words. Make sure everything is clearly visible, and use words and graphics that are common to people. These are certainly not all of the things you can do, but just some of the considerations that can help improve a patient's experience from when they're on the phone to when they walk in the doors. And another point I want to highlight is around training of healthcare staff. So keep in mind this not only includes those providing direct care, but office staff and volunteers as well. So in order to make sure that all members of the staff understand the importance of health literacy and what their role is, or even more so what their role could be, there needs to be a commitment to education, training, and awareness building. Office policies should be in place to ensure that key staff are trained and up to date, and the staff should be made aware of any local health literacy data and issues, as well as what efforts are being done. So they should also know about any resources that they have access to that are available from organizations ranging from things like toolkits to patient navigation services. And attending webinars such as this one is certainly a great start. So what can you do to help improve health literacy in your organization? Think about your role. Obviously, you all have a strong interest in health literacy. Consider being the champion within your organization and help lead efforts and help raise awareness, or perhaps you already are. Evaluate all of your patient materials, including patient forms, on an ongoing basis. Develop and select patient education using principles that your organization will follow. You can feel free to use Clear by Design or other available principles, or come up with your own version. You might want to make it a checklist. And overall, just be sure to consider your environment as well as staff training. some, many, or even all of these things you may already have in place or may already be doing, which is really great. So just remember that health literacy is not just being able to read and understand written materials. Health literacy happens all around us, and there are really many wonderful resources that exist to help us. So as we're wrapping up, here are some resources that will be available for you to download after the webinar. One is the Beyond the Core infographic we walked through at the beginning. We hope you'll find this valuable to learn about the 3 types of health literacy, and as I mentioned, you can absolutely feel free to share this. And the second is a resource list of the health literacy principles that we went over. Again, you can feel free to use some or all of these principles in your practice. And the last one is a list of key resources to help you address each of these types of health literacy: core, engaged, and influential. As I mentioned earlier, there are some really great resources out there, so we don't need to recreate the wheel for everything. So just going back to Beyond the Core, so today's webinar was primarily focused on core and also influential health literacy, thinking about your role, the fact that you're here today and we are sharing this information, your possible role in assessing your healthcare environment. The next webinar in this series will be focused on, was titled Health Literacy, Skills for Moving from Mission Impossible to Mission Accomplished, which will be focused on engaged health literacy, combining the teach-back method with motivational interviewing. And as Dominica mentioned, it's going to be on Wednesday, April 24th, and presented by Dr. Jim Duddle. So be on the lookout for an email. It should be really enriching. And if you have any questions or feedback, you can always share them on Surround Health, and we'll do our best to answer them.
Great. Thank you so much, Rita and Ken. That was terrific. So now we are on to our Q&A portion of the presentation. So if there are any other questions, I have a couple here. So the first one is, so I'm not able to develop my own materials, but I do evaluate them in my practice. Which one would you say is the most critical to focus on if I'm not able to focus on all the principles that you mentioned today?
Yeah, I mean, I would think that one of the things to look at is how dense the copy may be and what reading level that copy is written at. It's really easy, as we mentioned, by using the Fry tool to understand the grade reading level of that content and then understand then what you might need to be able to do to revise it to make sentences shorter and less complicated. We always look at that as a core when we're looking at materials that we're developing and making sure that we're writing to the 7th grade reading level or lower.
Okay, great. Thank you so much, Ken. There's another question about the difference between digital materials and also written materials. Is there a difference between the two?
Yeah, we get this question a lot when we're presenting our health literacy principles, and there are differences between the two. One of the most noticeable is the use of the type style of font. You would want to use a sans serif font for materials that are digital in nature because the letters with the hooks and tails are harder to read in an online environment. A lot of the principles do overlap, but there are many more that get into the interactive nature of the medium as well as navigation. And those, you know, we do also offer a Clear by Design health literacy principles for digital as well. But yeah, thanks for the question.
Okay, thank you, Ken. Another question is about the most common mistake that you typically see in brochures. Is there the most common mistake, and if so, how can we go about addressing it?
Well, I have one. I know for me it's showing imagery that has nothing to do with the copy that's around it. Imagery can really help people who only scan the material to get the information and don't really dive deep into reading. And those images play a very important role in making sure that we can start to craft a more positive approach and behavior to their treatment regimen. I think Rita might have something to add here too.
Yeah, the one thing I'd also add is I feel like sometimes trying to do too much in one piece. So it goes back to the focusing on a concept or what you want to communicate and outlining that from the beginning so that you're not trying to do too much and have the reader learn too much in one piece. So I think it ties in also to the density of the materials. So, again, just packing it in and trying to get all of your information in one place. But, I think you still can accomplish a lot of that in ways, depending on how it's presented, broken up, chunked, and laid out for the user. So, even with the interactive materials. But I think sometimes trying to accomplish too much or put too much content into one piece for people to digest is something that I see commonly. Thank you.
Great, thanks so much. So there's actually a question about if there are any free places that you could recommend where you can get the free pictures, for example, or free designs of the brochures, etc.
Yeah, I mean, I know a lot of people go out to Google Images or Bing Images and search for imagery, but you also have to be aware of the understanding of usage rights and making sure that you're not, stepping on anyone's toes. We don't typically use any free imagery, but there are images out there available for as low as $2 to $4 on stock sites. Such as Getty1.com or Corbis or Comstock. We always try to find imagery that pertains to the content that's being described, and we haven't really had any issues in finding that at an affordable price.
Great. Thank you so much, Ken. So you did mention using the Fry method. Can you please speak to exactly why you chose the Fry method for recommendation versus some of the other tools that you would use?
So we've been using the Fry here at Health Ed for many years. I think we just find that it seems to be the one most preferred by health literacy professionals. I know that there's a few out there that to choose from. We do have software that we use, as well as even a few years ago where we did it all by hand. Just in terms of really looking at the sentence structure and breaking down the words and the syllables, we just found that it seemed to be the one that really helped us get to the reading level we needed to be at, in terms of for our pieces. But I think that they're all absolutely valuable to use. But we just here at at Health Ed, and it seems that we've been really focused on the Fry software.
Great, thanks, Rita. Ken, do you have anything to add?
Yeah, I think I was just going to say that we use the Fry method here because it's the one that brings you the closest in to the correct grade reading level. Some of the others, like the Flesch Kincaid, I know that happens within Microsoft Word, can give you a grade reading level that might actually be 3 times lower or higher than what you really think it is and what it actually is.
Great, perfect. So there's a question about what tool we should actually use to assess the patient's health literacy level before giving them a specific brochure.
Yeah, I know that there's a few out there. I'm just trying to think off the top of my head. I know there's a wonderful resource on Surround Health that talks about that has some different tools out there, and the Universal Precautions Toolkit may also list some as well that the AHRQ has put out. So I would suggest, I don't know exactly, I'm trying to blanking on what the name is right off the top of my head, but I would check the AHRQ Universal Precautions Toolkit, and as well, like I mentioned, there is a tool on Surround Health that does list out some of the tools to actually assess your patients.
Great, thank you so much. And if I may add, you also just want to use universal precautions in general. It's best to assume that every patient has low health literacy. So the next question is about the presentation and actually getting buy-in from the organization. We're getting some comments that this was great, but how could you go about convincing the administrative staff about being able to assess your environment for healthcare literacy principles? Any suggestions or ideas?
So I think, just thinking about starting with, showing them some of the data and some of the literature that's out there. I mean, really just in terms of the impact that low health literacy has on, again, not just the patient, but the whole healthcare system as well, from, how, it affects costs. I mean, really across the board. I mean, the patient's outcomes. So I think, starting with the data, but then also really just showing, kind of how, I mean, again, using a universal approach to how we treat our patients. I mean, it's something that, again, not just folks with low health literacy benefit from, but really every individual does. So, I mean, thinking through, your own personal preferences, but I think looking at the literature, the data of what outcomes are tied to low health literacy is really a place to start when you think about your organization. And I also would just say, thinking about the Beyond the Core infographic, that it's beyond just reading and writing, but there's so many ways that health literacy impacts, people in general as they're learning and taking care of themselves, and what are the things that people need to be able to do. I also think, one of the surveys that's out there, that the pie chart that you had looked at was based on, really, emphasizing, what are the assumptions that are out there about what people with basic or below basic skills can do, and what do people really actually need to be able to do to manage their health. So I think kind of pulling through some of that for your, organization can hopefully help validate the need to focus on health literacy. And Ken actually just wanted to add on to that as well.
Thanks, Rita. Yeah, I mean, I know in my experience of presenting to places around the country, one of the things that really becomes the aha moment during the presentation is the before and after example. And so perhaps you might want to be able to use the one that we've shown here in the presentation to speak to a colleague about, to really fully understand what it means to develop pieces that are health literate in nature and really utilize all those great principles of behavior modification to get patients to really have more positive action on their treatment.
Great, thank you so much. And the last question is about bilingual materials. If you're trying to reach a bilingual patient population, do you recommend combining both bilingual messages or really just having two separate sets of materials?
So we'd recommend having two separate sets of materials for various reasons. I think just in translation, how some things get communicated can be different, and also just thinking about the visuals and how they connect with the visuals in the piece itself. You want to be speaking to the audience. So, I think that the patient populations would definitely benefit from two pieces, and then I think also in terms of just making sure that it's clear. I know some pieces try to do both, maybe reverse the order or whatever it is, but I think just having them separate and having them identify with that piece and that it's really focused on them is helpful.
Okay, wonderful. So it looks like it is time now to go ahead and wrap up. Just wanted to note a couple of things. Thank you again very much to the National Communication Association for sponsoring today's webinar. It has been wonderful, and we hope that all of you attending found it very useful. We also hope that you join us for our next webinar. As Rita mentioned, it is titled Health Literacy, Skills for Moving from Mission Impossible to Mission Accomplished. And that will be on April 24th, and we will be sending you an email invitation, so stay tuned for that. We are also hosting an ongoing discussion with Rita and Ken within the webinar topics section in Surround Health. So if any questions come up over the next couple of days as a result of the webinar, please just go into Surround Health and join our discussion. You will be receiving a webinar completion certificate, and it will be in your Surround Health profile starting tomorrow. But we do want to make sure that if you are looking to get CHES or RD credits, that you complete your feedback survey that you will get in your thank you email. Again, thank you all very much for joining us, and have a wonderful day.